We have been conducting a number of clinical trials looking at different immune checkpoint inhibitors in AML, MDS, as well as CLL. And a lot of this work started when we initially started looking at AML patients, and in collaboration with the immunotherapy platform, we saw high expression of a number of immune checkpoints, including PD-1, OX40, CTLA4. So now we have about 12 to 13 different clinical trials looking at different combination approaches. In AML, the drugs that we're focusing on are Nivolumab as well as Ipilimumab. We conducted a study of Azacitidine with Nivolumab. We presented the data about 2 months ago at the American Society of Hematology meeting, and this was in relapsed AML patients. What we saw is that the response rates when you combine Nivolumab with Azacitidine were higher than what we have historically seen with Azacitidine alone. More importantly, those who achieved the responses, about 35% of them, had very durable responses, which is also unique from what we see with Azacitidine alone. We also did a lot of immune profiling at baseline and on treatment in these patients, and we saw that the people who had a response developed increasing T-cell infiltrate as they responded, and also the T-cells had a favorable immune profile with more CD8s and more CD4 effectors, as opposed to those who did not respond. Those patients did not show any favorable T-cell infiltrate in the bone marrow. So we also saw that the CTLA4, which is another major immune checkpoint beyond PD-1 and can be targeted with a drug called Ipilimumab, went up in almost all the patients, whether they responded or non-responding, leading to the conclusion or the hypothesis that if we combined both Nivolumab and Ipilimumab and block both major immune checkpoints, we may be able to further increase the response rate from 35% to maybe 60 to 80%, which has been done in melanoma, lung cancer, other tumors. And we're now moving into a frontline treatment since we saw good tolerability as well as encouraging signal in the salvage. And we have a frontline study of Azacitidine and Nivolumab, as well as study of Azacitidine with Nivolumab and Ipilimumab that will be coming soon.